Health authorities in Mexico have reported on the evolution of the COVID-19 epidemic, noting that they're in the final stage of the third wave. We have more details in the following report by our correspondent Eduardo Martínez.
Mobility on the streets of Mexico City has gradually recovered and will continue to do so after authorities reported changes in the epidemiological indicator to green, which represents a significant reduction in viral transmission.
I feel that some measures are in place in different establishments, but depending on the place in question, it is insanitary. Many people could get sick again.
The reason why I do not feel safe is that during the red indicator, there were already a lot of people on the streets. Now with the green indicator, there will be many more people and COVID will return. Despite the change, the authorities appeal to the residents of the country's capital to maintain the health measures to avoid an increase in the contagion of the coronavirus, which has resulted in 3.5 million confirmed cases and 283,000 deaths related to the disease in the country. Those responsible for managing the health emergency explained that the reduction in cases and hospitalizations suggests that the third wave of contagion is coming to an end. Let us remember that we have already had reductions of approximately this scale of 11 weeks, and, as you can see, at this moment the incidence of cases is lower than the lowest level we had between the first and second wave. If this is sustained for the following weeks, we will surely be at the absolute lowest level of the epidemic. To date, the country has received 130 million doses of 7 different vaccines to fight the coronavirus. 77% of adults over 18 years of age have received at least one dose. President Andrés Manuel López Obrador insisted that the World Health Organization speed up the approval of all vaccines that have been proven to be effective in fighting COVID. It cannot be that they do not approve them. It would be very unlikely because we are talking about health. We are not talking about political or ideological issues. So I hope that when the letter arrives, they will consider it and resolve the issue. Meanwhile, the goal of immunizing the entire adult population by the end of October is unchanged, and vaccination of minors between 12 and 17 years of age with chronic diseases has already started in some states.
Eduardo Martínez, teleSUR, Ciudad de México.